name is Isaac Reichman. I am the Director of Public Information at the City of Chicago Department of Business Affairs and Consumer Protection. Welcome to today's webinar, the new COVID-19 regulations for businesses. A little bit of housekeeping before we get started. This webinar is being recorded and it will be posted to our website, hopefully by tomorrow or most likely by early next week. You can find it on the same website. You will be able to find it on the same website that you used in order to join this webinar. That's chicago.gov/business education. If you have any questions through the course of this webinar, please use the chat function, which you'll find is the function I just used to send you all the business education link. Please use that if you have any questions. Additionally, if you have any other questions on most of these slides on this webinar, you will find the BACP outreach at cityofchicago.org email address. We may not get to every question. We have a lot of attendees on today's webinar. We may not get to every question, or there may be some questions that I'm unable to answer right now that I may need to check with some of my colleagues or may need some follow-up. And if that's the case, please don't hesitate to send your questions via email to bacpoutreach@cityofchicago.org. Today's webinar, as you know, is all about the new restrictions that are in place for businesses effective today. A little bit of the agenda for today's webinar. We will start by giving a update on the health metrics, where we are right now, and why these new regulations are in place. Because I just want to reiterate, and I'll reiterate it throughout this webinar. I'm truly saddened to be here giving this presentation today. I know that we know in the city that this is an incredibly challenging time for businesses, but we also are frankly very, very worried about what the data is telling us and about the direction our city is moving in, and our region and our state and the entire Midwest and really the entire country is moving in our fight against COVID-19. So I want to talk through a little bit of the health metrics. I'm not the health department, I'm not the health expert, but I think it's very important to guide our conversation with that. Then I'm going to talk specifically about the changes to the Phase 4 guidelines that are in effect today. Then I'm going to provide an overview of the guidelines that are in place specifically for food service and bars. Obviously, there's a number of different businesses that may be joining us today, but I think the most relevant for this conversation is restaurants and bars. So I will be going into a little bit more detail on the existing regulations for those establishments. I want to remind everybody to visit chicago.gov/reopening for the latest on our health metrics and for the latest on our reopening guidelines. Please visit chicago.gov/reopening. I'm also going to type into the chat a link that you guys can use to specifically find the health order that is in effect as of today. So via that link, you can find it on the reopening site or on the city's coronavirus main page. There's the link for the new health order that is in effect as of today. So as I said, before we get into the new the new restrictions, the new regulations, I wanted to provide an overview of the health metrics. And as you can see, and as you will see throughout, they're very, very concerning. So this data, let me just preface, is as of yesterday. So the fact is, the data is even worse as of today. So average number of diagnosed new cases per day in Chicago, 645 new cases per day. This is skyrocketed compared to what we were a month ago, 2 weeks ago, even 1 week ago. We're increased 54% in just 1 week. So 1 week ago, we were at 418 cases, which was high and we were concerned. And this week, we're already over 600. I believe today we're at 678. So we're up even more today than we were yesterday. This is your 7-day rolling average. We've actually had some individual days that have had over 800 and even over 900 new cases come in. So the 7-day rolling average as of yesterday was 645, which is incredibly high. But we've had some individual days with 800 or 900. And this is the most we've had since we were in our peak back in March, April, and May. So this is truly the second wave of COVID. We've been health officials have been warning us about this for a while. I want to draw everyone's attention also, and I'll type it into the chat as well, so please visit chai.gov/COVID- for the latest update on the city of Chicago numbers. So wanted to show the reopening metrics. This is something that we have been looking at, that the health department has been looking at a number of different metrics to determine where we should be going regarding reopening. And as you can see, just in the last week, we have moved into that red, which means that we need to stop and pull back some of those guidelines. We've had a sustained increase now for over 14 days. And our positivity rate is still in that yellow, but it's trending very, very dangerously close to that 8% number, which is very concerning. And as you can see here on hospital beds, we're still sufficient. We still have more than enough hospital beds at this point, but we are moving in the wrong direction. Hospital capacity is starting to be tested. We're still nowhere near there, but hospitalization rates are going up, and that's very concerning. So this is the graph that shows the rate of case rate per 100,000. So basically the number of cases in Chicago. As you can see, we spiked back in April and May before flattening the curve and coming down. And while we have gone up slightly over the summer and then back down in September, we never really got too high at that time. But then as you can see over these last 2 weeks, there has been an alarming increase in cases. They're now increasing and growing at the same rate as they did at the worst of our first wave. So cases are going up just as fast as they did back at the end of March and the end of April, which was the worst time for cases here in the city of Chicago. And not only are cases going up, we're not just seeing it among young people. Some of the rise we saw over the summer was pretty much limited to young people in that 18 to 29 or 30 to 39 range. That is not the case anymore. As you can see in this oval here on the right side, cases are increasing across the board, across all different age groups. Now, our highest case rate is still for young people in that 18 to 29 or 30 to 39 range. But when young people get it, they transfer this disease to older people often, older people who then are much, much more likely to have severe outcomes. So you can see in this green here and the pink and the gray, those are the 60 to 69, 70 to 79, and 80 plus. Those numbers are also increasing significantly. And we know the older you are, the more likely you are to have severe outcomes from COVID-19. Also, test positivity is increasing. We have increased the number of tests, which is great. We're over 11,000 tests today. That's wonderful. But the increase in cases is not just because of an increase in tests. That is shown by our test positivity. We've been around that 4.5%, 5% for a while. We got under 5% for about a month. But now, as you can see here in the end in purple, we are rising significantly. Just last week, we were in the 4 to 5% range. We're now at 6.4%. Again, this number was as of yesterday. Today, we are at 6.7%, and that number continues to go up every day. And I want to make it clear, it is not just cases. A lot of the arguments you might hear is that case rate is one thing, but what about hospitalizations? What about severe outcomes? Hospitalizations are also going up. Number of people who are hospitalized for COVID or COVID-like symptoms that they've not yet been tested is up 40% since towards the end of September. So hospitals, according to our health department, hospitals around the city are starting to prepare to activate areas that have not been activated since the first wave of COVID back in the spring. So hospitalization rates are going up. And while our death rate has remained pretty steady, we know that that is a lagging number, that when cases go up, then hospitalizations go up, and then deaths go up. And we've already had over 3,000 people die in the city of Chicago from COVID, and we expect that number to continue to rise, and we're very, very concerned. Okay, so now before getting into the specific measures that the city is taking that are in effect today, I want to make one thing clear. Part of the reason why we took the measures that we did is because Chicago is trending very, very close to the statewide mitigation measures. According to the Illinois Department of Public Health, if Chicago's positivity rate, or if any region's positivity rate, goes above 3% for 3 straight days, we may be subject to additional statewide mitigation measures. So if we get above 8% for 3 straight days, statewide measures kick in, something that the city of Chicago does not have any control over. And those are even stricter than what we already have in place, including no indoor dining at all across the board throughout the city, and also reduced capacity at other businesses. And according to the state of Illinois, we are now at 7.0%. They track their numbers just a little bit differently because they get things reported to them a little bit before our health department does. So according to them, we are at 7.0%. Just a little over a week ago, we were under 5%. So part of the reason why we took the measures that we did is because we want to try to get ahead of what we know is coming from the state soon. And hopefully, by taking our own measures ahead of time, we can either prevent these statewide measures, or if they do come into effect, we can minimize the length that they are in effect. Great. So I've seen a couple questions come in through the chat related to the health metrics. I just do want to make very, very clear that I am not from the health department. I am not the health expert. Got a question in, so got some specific questions about including tests, things like that. That is something that unfortunately I'm not the expert on. If you send us that question via email, I'm happy to help get an answer. But I do know the one thing, in addition to cases that we are looking at, as I said, is that hospitalization rate. And that is why that is so concerning. It's not just cases going up, it's hospitalizations going up as well. So no matter how we test, no matter how many people we test, hospitalizations going up to the extent that it is very concerning. If you have any additional specific questions about the health metrics, though, do ask that you send those via email so I can get answers to them from our health department. Great. So I'm going to go into all of these in a little bit more detail, but I wanted to first provide an overview of the new restrictions, the new regulations that are in effect today, October 23rd, as of 6 a.m. There are 3 main new restrictions. First, there is a non-essential business curfew. This means that all non-essential businesses must be closed to the public between 10 p.m. and 6 a.m. And I'll talk a little bit more detail about that on the next slide. Second, no indoor service at taverns. So a bar, tavern, brewery, lounge, any establishment that sells alcohol for on-site consumption but does not have a retail food establishment license can no longer serve indoors. Finally, there is an across-the-board 9 p.m. liquor curfew. This means all liquor sales to go, delivery, on-site consumption, whether you're a bar, a tavern, a brewery, a packaged goods liquor store, grocery store, they all must end at 9 p.m. A little bit about this. Again, I'm not the health department, so I can't speak too much as to the reasoning behind this, but I do want to make a couple things clear. First, the health department knows that, as the health department has said, a lot of the transmission is happening among people who do already know each other. And a lot of it is certainly happening at private gatherings, at private social gatherings at people's homes. But we also know from contact tracing that the most common indoor public place that people with COVID-19 are visiting is bars and restaurants. And when you go to a bar or to a restaurant, especially late at night, we know that you have to take your mask off in order to eat or drink. And also bars and restaurants can often be a little bit noisier and forcing people to closely interact. And then also when drinking, especially later into the evening, people tend to lower their inhibitions, which can then lead to riskier behavior. So again, don't want to fully speak for the mayor, for the health department, but I do want to add a little bit of context as to where these restrictions are coming from. First, and I see a couple questions come in. I promise I will get to those. I'm going to talk about each one of these different regulations in more detail. First, all non-essential businesses must be closed to the public between 10 p.m. and 6 a.m. What do we mean by closed to the public? That means your doors need to be closed and you can't have customers inside unless they're there for an essential business reason. So that doesn't mean you seat your last customer at a restaurant at 10 and then they can stay till whenever they want. It means that you cannot have customers there eating or drinking or still congregating after 10 or before 6 a.m. Takeout, delivery, curbside pickup may continue during these business curfew hours. So that is considered an essential business activity. Takeout, delivery, curbside pickup of food at a restaurant that may continue during those curfew hours. Other essential businesses are exempt. And this is just a short list. This is not the full list of businesses that are exempt. As a general rule of thumb, if you were considered an essential business back during April and May when we had the stay-at-home order, you are still considered an essential business and you may continue operating during the 10 p.m. to 6 a.m. business curfew hours. This includes stores that sell groceries and medicine, pharmacies, grocery stores, corner stores, convenience stores, gas stations, bike shops, transportation, meaning taxis, ride hail, stuff like that is considered an essential business. Now I have banks on there, it's an essential business. Obviously they're not typically open from 10 p.m. to 6 a.m., but they do fit under the essential business definition. Hardware and supply stores, laundry services like laundromats, daycare centers, and hotels and motels, but only to the extent that they are being used for lodging. If a hotel has a restaurant in it, then they need to follow these guidelines here. So what does this apply to? So some things that are considered non-essential businesses. Obviously, bars and restaurants for on-site dining or drinking must be closed between 10 p.m. and 6 a.m. This also includes, again, bars and restaurants that are at hotels, things like that, must be closed between 10 p.m. and 6 a.m. Also, any sort of event or performance venue. That means if you're using your business for a private event or having any sort of performance, movie theaters, customers need to be out by 10 p.m. This also does apply to health and fitness centers. We've gotten a couple of questions about 24/7 gyms. Gyms do not count as essential businesses, and they do then need to be closed between 10 p.m. and 6 a.m. Great, and I've posted it on the chat, but I'm going to actually throw it into the chat again. I recommend if you have any kind of very, very specific, detailed questions on essential versus non-essential, to please read the order itself, which I just added to the chat again. Please read the order itself, and it provides a much, much longer list of what is considered essential. The second new regulation is no indoor service at bars. While I wish this wasn't the case, this is the same regulation that was in effect for much of the summer. So it is the same sort of regulations apply as they did over the summer. So no indoor service is allowed at any establishment that serves alcohol and does not have a retail food license. Any establishment or venue, tavern, bar, brewery, lounge, that has a liquor license, serves liquor, but does not serve food can no longer operate indoors. However, outdoor service is still allowed under the number of different definitions of outdoors. That includes outdoor patios, expanded outdoor dining areas, which can include the street or sidewalks or private parking lots, rooftops, retractable roofs, and also, as a reminder, indoor spaces where 50% or more of a wall can be removed by opening windows, doors, panels, anything like that tables that are within 8 feet of those openings are considered outdoors. So again, outdoor service is still allowed. Note, outdoor service must follow the regulation we just covered of the non-essential business curfew. So if you're a bar or a restaurant and doing anything outdoors, you can continue to do so, but you must still be closed between 10 p.m. and 6 a.m. And again, establishments that serve food may continue indoor dining or drinking under the existing regulations. Had a couple questions come in related to this. A bar without your own food license, but you have a food partner, what are you allowed to do? If you are, unfortunately, if you are a bar and you do not have a food license, your own bar's food license, then you cannot be open indoors. The bar itself, the establishment itself, must have a retail food license in order to operate indoors. Had a question, does the outside street permit now end at 10 p.m. where it used to be 11? Yes. This order supersedes any of the specific language, any of the specific rules related to your outdoor patio, or your expanded outdoor dining permit, or your sidewalk cafe. The order to close at 10 p.m. supersedes any of that. So now, if you are operating an expanded outdoor dining permit, that is considered a non-essential business, and you need to close that operations, stop that operations at 10 p.m. Finally, there is now a liquor sale, alcohol sale curfew at 9 p.m. And just as a point of clarification, when we use liquor sales, I really mean all sort of alcohol. Liquor sales must end at 9 p.m. This applies to all licensed liquor establishments, taverns, consumption on premises, incidental activity, and packaged goods, and all types of sale, including the sale of alcohol to go, the sale for delivery, and the sale for on-site consumption. So if you have a restaurant that is operating indoors that sells alcohol, last call has to be at 9 p.m. Last call is at 9 p.m. That is when you must stop selling alcohol, and then you must close your doors under the non-essential business curfew at 10 p.m. Additionally, as I said, this applies to delivery, and delivery must be completed by 9 p.m. You can't be going out, starting your delivery at 9. Delivery must be completed by 9 p.m. To clarify, when I say last call, I mean that the purchase of the alcohol must be actually served by 9 p.m. So last call must end at 9 p.m. is probably a better way to say that. Okay. I got a couple questions related to this. If liquor sales end at 9 p.m., what time do alcoholic beverages need to be off the table? So the people that purchased alcohol before 9 p.m. may continue to drink that alcohol until you close your doors at 10 p.m. So there's not a specific, so the time at which alcohol must be off the table is 10 p.m., which is when your establishment must be closed. All right, so I wanted to take a quick minute to go over in a little bit more detail now. I see a couple questions come in related to this, but I'll get to those in just a second. Food service, and I want to talk about all of the food service and bar regulations. First, as a reminder, the changes are here in red. Indoor dining and drinking is allowed only at establishments with a retail food license. Indoor dining is most other things here have not changed. Indoor dining is allowed, but limited to 40% capacity with a maximum of 50 customers in a room or a floor. Outdoor seating is allowed whether or not you have a retail food establishment license. Face coverings must be worn by customers and employees, except when seated and actively eating or drinking. This is the number one thing that our business compliance investigators have found. Please, face coverings must be worn by all customers and employees, except when seated and actively eating and drinking. And to that point, all patrons must be seated while they are eating and drinking. Tables must be 6 feet apart with no more than 6 feet per table. All alcohol sales, as I said, must end at 9 p.m. and establishments must close to the public between 10 p.m. and 6 a.m., though takeout, delivery, and curbside pickup may continue. Cocktails to go can be sold the time when liquor sales are allowed. They must be sold in sealed and tamper-evident containers. We strongly encourage reservations, and it is your responsibility to manage lines and ensure social distancing. And if you do not have food, this is an existing regulation, you must limit seating to 2 hours per party. Let me just put up the last slide here, and then I'm gonna open it up for questions for the last bit of time here. I wanted to make sure to take this opportunity to provide a couple additional updates that are important to all businesses. And again, I will take a minute to answer a couple of the questions that I am seeing come in. So one thing I want to draw everyone's attention to is that there is pending legislation that will extend the license expiration dates for all licenses that expire between March 15th and December 31st, 2020. These licenses can renew without paying a late fee until January 30th. And I apologize, that should say January 30th, 2021. I will actually fix that right now. Sorry about that. Great. They can renew without paying a late fee until January 30th, 2021, January 30th of next year. So now this legislation has not become law yet. It just passed City Council committee yesterday, and it will be voted on by the full City Council on November 16th. Now, again, it is not law yet. However, we anticipate that it will pass and become law on November 16th. Therefore, any licenses that would fit within this extension, we will not be accruing late fees. We will be not expecting you to renew. We will not be enforcing against that renewal because we anticipate that those licenses will be extended until January 30th of 2021. Again, it is not law yet, but we anticipate that it will become law just next month. So any licenses that expire between March 15th and December 31st of this year will be able to renew without paying a late fee until January 30th. I also want to draw everyone's attention to some funding opportunities that are available today. Just want to make sure, again, everyone is aware of these. First, if you have not pursued the Illinois Business Interruption Grants Program, I strongly recommend that you pursue this program. This is run by the state of Illinois, the Department of Commerce and Economic Opportunity. And there are grants available for businesses throughout the state of Illinois, specifically focused on underinvested communities, on businesses and industries that have been impacted to an extra extent by COVID-19, which includes bars and restaurants and venues that have been forced to close, and specific for other hard-hit industries as well. So again, that's something that is done by the state of Illinois. You can learn more at illinois.gov/DCEO. Second, the Department of Cultural Affairs and Special Events has a performance venue grants. You can learn about that at chicago.gov/DCASE. That deadline for that grant application is actually today at 5 p.m. So if you're interested, I recommend getting off this webinar and applying today. Learn more again at chicago.gov/DCASE. Finally, I want to draw your attention. DoorDash has put $500,000 up to support Chicago businesses in outdoor dining. Learn more at doordash.helloalice.com. Additionally, for businesses in low-income community areas, I want to remind everybody or let you all know that Talk is offering a free setup and 6-month subscription to Talk Plus Lite for bars and restaurants. Again, free setup, 6-month subscription to their reservation service. I strongly recommend that folks pursue that. You can learn more at exploretalk.com. Right now, I do see a couple questions coming in here. and I will take a minute to answer those. We have a couple minutes left, so I'll make sure to answer those. If I do not get to your question, or if I am unable to answer your question, I'll ask that you please submit those via email. Again, some questions may require me to consult with some of my colleagues, so you can submit those via email. I'll type it into the chat. It's also on the bottom of the page here, BACP outreach at cityofchicago.org. So let me take a look at some of these questions. And a question here, a wedding venue with a rooftop that does not serve food but does serve alcohol, they can only serve alcohol on their rooftop. That is correct. And again, since you're only serving alcohol and not food, you cannot have any sort of indoor service, which means that the patrons must be staying outside because they need to be, again, seated while they are drinking those beverages. So again, a wedding venue with a rooftop that does not serve food cannot be open for indoor places. Right. I had a question about gyms and what this means for gyms. So that the new non-essential business curfew, which is in effect from 10 p.m. to 6 a.m., applies to gyms. So gyms must be closed between 10 p.m. and 6 a.m. No other regulations at this point are changing for gyms. Okay. I had a question about a boutique fitness studio. Are there any new changes for us at this point? At this point, no, there are no specific changes for boutique fitness studios, except that you must be closed between 10 p.m. and 6 a.m. No specific plans in place for what might happen in the future, but we'll definitely make sure to communicate that as well. I had a question, what are the time constraints for parties that are seated and eating? Now, if you are a restaurant, there is not a formal amount of time that you are required to limit parties, that you're required to limit parties at tables to. You must, however, close again at 10 p.m. and you must not stop serving alcohol at 9 p.m. Actually got a clarification here, so thank you. I want to let everyone know that if you received a round one business interruption grant over the summer, you are eligible for round two if you can show losses of over $40,000 this year. So thank you for that clarification. I want to really, really push everybody towards this business interruption grant program. It's run by the state of Illinois, not by our department, so I do not know all of the details on it. But if you send us an email, I'm happy to connect you with some folks over at the state or at some other organizations that are helping administer it in order to get your answers there. But again, really want to point everyone towards that opportunity. It's something that we really want to make sure every business is aware of. Got a couple questions, and I believe I got a couple questions around the detail, very, very specific details on when to close the, when that 9 p.m. liquor curfew is in place. I'll ask if you can just send us an email. I can make sure to give you the specific answers there. Our general guidance is the last alcohol can't be served, alcohol can't be brought to the table after 9 p.m. So you cannot, pay for it and then, here's $50 and then just keep bringing alcohol after 9 p.m. So our general guidance is alcohol must be brought to the table at 9 p.m. at the latest. Questions about ice skating rinks. So now ice skating rinks would be considered a non-essential business. So they cannot be open after 10 p.m. or before 6 a.m. However, they would otherwise fit into the most likely into the health and fitness center category. So ice skating rinks can be open provided that you're following capacity guidelines. Are reservations mandatory? Reservations are not mandatory for bars or restaurants. That is something that we are strongly recommending, but reservations are not mandatory. Question just to clarify, yes, there are no specific time constraints on tables. if you are eating there. You are limited to 2 hours if there is no food, if you are an establishment that does not serve food. But if you are a restaurant, then there are no time constraints on those tables. And a question about Lincoln Park Zoo. I will be honest, I do not know the specifics for Lincoln Park Zoo. Feel free to send us an email and at BACP Outreach, and we can get you that answer there. Again, I want to remind everybody to send in their questions. Send in their questions via the chat function. I'm seeing now that a couple have come in through the Q&A, but it's much easier for me to read them through the chat as we're going through here. I got a question. Events such as weddings at private event spaces, are they still 50 guest max? Yes, the existing guidelines around events, 50 guest maximum with no more than 40% total capacity. However, again, non-essential business curfew, that means weddings and other events should also be ending, or required to be ending by 10 p.m. The question, is there a limit to how many people can sit at a table in a restaurant 6 feet apart? Yes, no more than 6 people per table. That's the same for restaurants, wedding venues, bars, any establishment like that, no more than 6 people per table. And I got a couple questions specifically related to the outdoor ice rink. Can please send me an email on those questions to bacpoutreach@cityofchicago.org, and I'll help get those answers. Another question about capacity. Yes, nothing has changed today related to indoor capacity at restaurants, at health and fitness centers, at personal services. Capacity is still 40% indoors. Though, please keep in mind that if our cases continue to go up, we will soon hit the state of Illinois threshold, which will lead to no indoor dining at all and 25% capacity at other establishments. Again, and just to clarify again, nothing has changed for capacity for daycare centers either. How long is the order expected to be in effect? This is certainly metrics driven. We're saying that it is in effect for at least 2 weeks. 2 weeks has typically been our range for when we may see some more positive changes, because 2 weeks is typically the incubation period. That's how long we tell folks to quarantine for. So it's in effect for 2 weeks. It's certainly going to be metrics driven though, so I recommend you all to take a close look at the data dashboard. Got a question for, at the wedding venue, this is a great question. At the wedding venue, if only non-alcoholic beverages are served, can the event be hosted indoors? That's a great question. Yes, if you're not serving alcohol, then you can be hosted indoors. You would have to follow the event venue guidelines, but it can be indoors. Question, does a bar must have a food license in order to sell food? Yes. You need to have a retail food establishment license in order to sell food. If you want, I can connect folks with our business license consultants. If you're interested in getting that food license, send us an email, bacpoutreach@cityofchicago.org. Still stick around for a couple more minutes to answer questions, but I just want to take a minute and reiterate. I know we covered the health metrics at the beginning, and again, I'm not the health expert, but I just do want to make sure to reiterate the worry that we are seeing and the health department is seeing in what's going on. We are very, very concerned. We're very much in the second wave of COVID, and cases are continuing to rise. We have not hit the peak. And we know that this is really incredibly difficult for so many of you. And we understand that, but we also call on all of you to help us fight this really deadly virus, and to also take personal steps. We're calling everyone around the city to take personal steps to minimize gatherings, to wear face coverings, to maintain social distancing. This is really a really important time in our in our city's history, truly, and we know that this is incredibly challenging. but we thank you all for joining this webinar. Joining this webinar means that you want to know what the rules are and you want to follow the rules. So thank you to all of you for that. Had a question, if I could, to go back to the first slide with the data. It's a number of different slides here. I'm going to leave it on this one for just a minute. Here's your website if you want to follow the data. I know I check it every day. Also take a look at the state of Illinois' website every day. So again, I know that this is incredibly challenging for so many of you, but you know, we wouldn't be making this step if we weren't very, very concerned about everything that's going on with the data. So great. See a couple questions come in. If someone can give us the link for the grants. I'll actually send you, if you give me 1 second, I'll send you the direct link to that page. Thanks for your patience. You go to this direct link that I just put into the chat. That's the direct link for the business interruption grants. Again, I want to thank you all for coming today. You see the BACP outreach email on the bottom of this slide. Please do not hesitate to reach out. Either myself or someone from the team will certainly follow up, and we can check with our health department, any other departments, if you have any other specific questions. So thank you all again. I wish we did not have to do this. I wish that I did not have to give this presentation today, but thank you all for your continued diligence and everything you're doing to help keep our community safe. Thank you.